Good day, this is Dr. Hilal. Human papillomavirus, or HPV, is a common virus that infects the skin and mucous membranes. There are many different types of HPV. Some types are considered low risk, while others are considered high risk. Most people who get HPV never develop symptoms. Their bodies are able to fight off the virus. However, HPV can sometimes cause health problems. HPV is a sexually transmitted infection. This means it is spread through intimate skin-to-skin contact. You can get HPV through vaginal, anal, and oral sex. You can even get HPV through close skin-to-skin contact during sexual activity. There are over 200 related viruses classified as HPV. Most of these viruses are harmless. However, some types of HPV can cause serious health problems. These include cervical cancer, anal cancer, and throat cancer. It is important to remember that most people who get HPV do not develop any health problems. However, it is still important to be aware of the risks and to take steps to protect yourself. HPV is spread through direct contact with infected skin. This can happen during sexual activity, including vaginal, anal, and oral sex. HPV can also spread through close skin-to-skin contact during sexual activity. Even if someone with HPV does not have any symptoms, they can still spread the virus. Most people with HPV do not have any symptoms. They may not even know they are infected. However, some people do develop symptoms. These symptoms can include warts on the genitals, anus, mouth, or throat. Genital warts usually appear as small flesh-colored bumps. They can be flat or raised. They may be itchy or uncomfortable, but they are usually not painful. Warts can appear weeks, months, or even years after a person is infected with HPV. It is important to remember that not all STIs cause symptoms. It is possible to have an STI and not know it. That is why it is important to get tested for STIs regularly, especially if you are sexually active. Certain types of HPV are classified as high risk. These types are linked to several cancers. These include cervical cancer, anal cancer, oropharyngeal cancer, which is cancer of the back of the throat, including the base of the tongue and tonsils, penile cancer, and vulva cancer. HPV types 16 and 18 are the most common high-risk types. They are responsible for most HPV-related cancers. These cancers often take years, even decades, to develop after a person gets HPV. Not everyone who gets infected with these high-risk types will develop cancer. Regular screening tests can help detect precancerous changes in the cervix caused by HPV. These changes can be treated to prevent cervical cancer from developing. There are several things you can do to protect yourself from HPV. These include getting vaccinated, practicing safe sex, and getting regular cancer screenings. The HPV vaccine is safe and effective. It can protect against the types of HPV that cause most HPV-related cancers. The HPV vaccine is recommended for all adolescents. It is also recommended for adults up to age 26 who have not already been vaccinated. Safe sex practices, like using condoms, can also help reduce your risk of getting HPV. There is no cure for HPV. However, there are treatments for the health problems that HPV can cause. Treatment for genital warts may include medications or procedures to remove the warts. Treatment for HPV-related cancers will depend on the type and stage of cancer. If you think you may have HPV, or are concerned about your risk, talk to your doctor. They can help you determine if you need to be tested and discuss prevention and treatment options. You can contact us at Hilal Medical